I'm going to attempt to share it on our day one page if I can.
Great.
After you.
Okay, so it looks like we are officially live, which is wonderful. This is the easiest it's ever been to get this program working. So I think we're actually 2 minutes early today. So welcome everyone. Thank you so much for joining us. We are here today to talk about the impact of Voca cuts on the Northwest region of Ohio. So we are thrilled to have two guests with us today. Ryn Farmer, the director of Day One at Crime Victim Services, so the Rape Crisis Programming at Day One, and she'll talk more about their services in a bit, and Ashley Ritz, the Executive Director at Open Arms. My name is Camille Crary. My pronouns are she, her, hers. I am the Director of Legal Services and Public Policy at the Ohio Alliance to End Sexual Violence, and we are so happy that you all are here today. I'm going to start out just by asking both of you to talk a little bit about what counties your program serves and what services you.
Go ahead, Ryn.
Oh, sure. Sorry. I was attempting to share on our day one Facebook page. So at Crime Victim Services, we serve both Allen and Putnam counties in West Central Ohio, but our rape crisis services actually serve a little bit more than that. We also serve Hardin County and some in Auglaize County as well. And so at Crime Victim Services, we believe that communities thrive when over trauma and when members prevail over trauma and support one another with empathy and respect. So we've been around since 1980, and our rape crisis services started in 1985. And we are an umbrella agency, so we don't just do rape crisis work. We do all sorts of work with victims of crime. And actually, when we started in the early 80s, we actually provide court advocacy in Allen and Putnam counties. So in most counties across Ohio, that is provided by the prosecutor's office with their victim witness departments. But we as a nonprofit agency actually provide those services in Allen and Putnam counties. We also provide CASA, court-appointed special advocates. We have an elder victim ministry program. We run the Child Advocacy Center of West Central Ohio. And then we also do domestic violence services in Putnam County. In Allen County, those services are provided by Crossroads Crisis Center. In our Day One department, we provide not only sexual violence services to survivors, we also provide services to survivors of human trafficking. And then we do violence prevention work in our school systems and in the community, really trying to promote a culture of consent.
So at Open Arms, we serve Hancock County, Ohio. We're kind of sandwiched in between Lucas and Wood counties, and Putnam and Henry on the other sides. We are a dual domestic violence and rape crisis service provider. So obviously our programs encompass domestic violence and sexual assault. We provide emergency shelter in a confidential location for survivors of domestic violence and sexual assault. We also offer 24/7 response to Blanchard Valley ER, the ER located in Findlay and Bluffton, Ohio. We are the primary response there. We have advocates on call for domestic violence and sexual assault survivors. We also are the advocates in our court system as well for domestic violence and sexual assault survivors. We only have, in our county, there's only one victim advocate and at the county prosecutor's office. So that's only for felony level crimes. We have no advocates in our municipal court. So our advocates are the primary advocates serving survivors. So this is obviously cuts impact that service as well, like you wouldn't believe. Along with that programming, we also offer a supervised visitation and exchange program. That's more for the domestic violence side, but it also impacts children who may be sexual abuse survivors. So that's offered at our public office. It's for children who've been removed from the home due to abuse or neglect. They can visit with their parents in a safe, secure location at our facility. And we also offer a violence recovery project, which is an offenders program of domestic violence. You don't hear a lot about those anymore. Not a lot of agencies offer those, but it is an effective program for those individuals that are court-ordered to attend it and that complete the program. We also are involved a lot in our city and county school systems. Here lately, it's more through Zoom than anything, but we provide a lot of prevention and education, and that's on the domestic violence, sexual assault, teen dating violence, bystander intervention, good touch, bad touch, all kind of stuff like that. So we consider ourselves kind of a full service agency. You know, you're not going to come to Open Arms and have to jump around to a bunch of different service providers in town. We're able to provide a lot of different services to survivors and their families, which we're very thankful to our community for allowing us to do so.
Thank you, Ashley. And I want to touch on something that you mentioned when you were describing services, and you spoke about the fact that there are no advocates in the court in your area. So your advocates are the advocates. And I'm wondering if you could share, and Rin, feel free to jump in as well, what the ideal, as far as we understand crime victim services, other than the obvious, which is that the crime didn't happen in the first place, but what the ideal situation, if everything was fully staffed, would look like for a survivor. You know, what the distinction would be between a community-based advocate and a prosecutor-based advocate, what hospital resources would be available, and what network of services we feel is actually necessary to meet survivor needs, even though we may not have the funding for that right now.
Sure. So if we're going to start at the emergency room, obviously a 24/7 response is necessary and ideal, and the law requires it, so it's not really an option. So having advocates on call 24/7 to be there with survivors immediately when they get to the emergency room, or if they go to law enforcement, maybe they might not choose to go to the emergency room, or maybe they'll just come to our office, or we'll meet them in a public location. Having those advocates available is our, ideal first response, and to be able to be there with them through the forensic exam, no matter if they choose to participate in that, no matter how long that takes, advocates being there with them to support them. If they do choose to make a police report, having an advocate there with them during that report, and supporting them throughout that. Next, with the police report, if they would make, then a detective's interview possibly would come along, and our advocates would also be there to support them through that. Next, throughout the legal system, we'd probably have an arraignment along there, and obviously discussing the next steps of the case with the survivor. I think a lot of times, people throw out those legal terms, and even for the average person, like, nobody understands that. What's an arraignment? What is that? So to just be able to tell a survivor, this is what's next, and this is what you have to be at. This is what we're expecting you to speak at. This is where we need your input. Just letting them know what's happening and that their case is progressing. A lot of times the legal system, especially in our community, and I think in a lot of communities, it takes a while to get cases through. And I think that's just because prosecutor's office and communities are inundated with a variety of crimes. And so typically sexual assault in general takes a while just to get through the criminal justice system. So, going through all those different court hearings with survivors, being there with them, letting them know the next steps, being there with them throughout those interviews, with follow-up interviews with detectives, follow-up medical appointments. Maybe if they want to get a protection order, being there with them as their advocate through that, assisting them with that intimidating paperwork, and just letting them know that they're not alone throughout this process. We also offer individual and group support. So I think that's one thing that's very important throughout the process too, is, letting survivors know they're not the only ones going through this, and having that peer support too throughout the process. So as we walk through all the different hearings in the criminal justice system, eventually, hopefully we would come to sentencing, and just being there with them. If they have the right to speak, or if they're not comfortable doing that, our advocates would do that for them. Like I said, we only have one advocate in our felony court system, so she is very busy with all of the other felony crimes. So she's not able to even meet with survivors or even really get to know them until it really gets to basically the last few days. If it comes down to a trial or sentencing, that's when she comes into play. So these survivors have now been in the system for 2-3 years easily, and she's just now meeting them. But the really nice thing about having our advocates is that she has that connection with them. She knows them, she's comfortable with them, and that the survivor definitely relies on our advocates. It would be really nice if we had advocates in our municipal court system or more even in our felony court system, because I can't imagine being a survivor and not having anybody or of any crime and being left alone to fend for myself and to have to figure out what the next steps are and to know what I'm supposed to do, what hearing I'm supposed to be at, and just understanding all those, fancy terms.
Thank you. Yes, all the Latin it feels very unnecessary all the time. Bryn, I'm wondering if you, in addition to adding any thoughts you have, can speak to, and Ashley already did give a really important overview of this, but what it means if hospital advocacy is no longer available and what that might look like. And we know that during COVID, we've experienced a lot of challenges with that. But in general, in pre-COVID and whenever we get to post-COVID, what is the purpose of that and what will be lost if that is unattainable? Because we know that the Voca cuts have also affected forensic nursing as well.
Sure. And just one other thing that I wanted to say in addition to what Ashley said. So we talked about in an ideal world, like if everything was working and the systems were working together, that's what it would look like. But then the other thing to think about too is that not all survivors want to work with the system or within the system. And so with these Voca cuts, if we do have a loss of advocates, even within our rape crisis centers, let alone within the court systems, that means that the survivors who don't want to go through the system don't have access to advocates who can provide case management services and support. We have a really large Amish community in Hardin County, and they don't always desire or feel comfortable working within the system. And same with some of our communities of color and other types of communities. And so with that loss, that means that then those survivors who need supports outside of the system, who still can maybe find healing through the trauma of what they've been through, that's not going to be available anymore. So I just wanted to make that distinction. I think, we talk about the ideal world of working with those systems and having a prosecution, but for some people that isn't what they want, depending on their situation. And so just acknowledging that as well. In terms of your question about hospitals, so we kind of have experienced this with COVID, right? Before we even had Voca cuts, we weren't able to go into our hospitals for a short period of time. So in the past, what happens is if a survivor goes straight to the hospital, we get a call from the hospital and our advocates who are on call 24/7 respond. Sometimes the survivor is alone, sometimes they're there with a family member, but what that advocate can offer is education about the process of what's going to happen. The sexual assault nurse examiner does a lot of different things through that process to make sure that they can collect evidence for the case. And so the advocate is there to help provide that support and education about what's going to happen. But then also it's a connection point for after they leave the hospital. So when that survivor is at the hospital and they meet an advocate in person, they then can build that rapport and trust with the survivor. And oftentimes we see that we have a longer term connection with the survivor when they have that in-person contact immediately after the crime, when that survivor is in a really vulnerable position. And so with COVID, we weren't able to go. And so what we were doing is we were calling, the nurse would call us on the phone. So we would talk to the survivor over the phone. And we honestly could tell a difference in that connection with the survivor and their desire to engage in services. What we ended up doing then was purchasing tablets for all of the hospitals. So we were at least able to have a face-to-face with the survivor through that tablet. And now we're responding in person. We have been since June again. And hopefully we can keep doing that. I know the cases are rising, but with Voca cuts, we got kind of a little bit of a taste of what that would look like if we weren't able to provide advocates at the hospital because of COVID. So I feel like it's kind of, it's intertwined in a lot of ways.
Thank you, Rin. And we're about to get a real slice of what parenting at home during COVID and working is, because there's some classical music in the background that I did not put on, but someone else put on. And I apologize for that. But thank you for that explanation and distinction. That's extremely valuable and extremely important to remember that we have a range of systems we need to be acknowledging, sometimes working with, sometimes working outside of. And as we cut down, we're really needing a lot of options that are available for folks. So I'm wondering, share how many survivors approximately you worked with in 2019, and how that impact, or how COVID impacted that, and maybe an estimate of how many folks you served in 2020 and how that's been.
Sure, I can start. So between the same period, so January through October of 2019, we worked with 499 survivors. And within that same period, 2020, we worked with 606 survivors. So actually we saw over a 20% increase. And we thought we might see a decrease. We did see a decrease at first. So between March and June, we definitely saw a decrease in services for survivors of sexual violence and human trafficking. But as Ohio kind of started opening back up again in the summer, we definitely saw an increase of people coming forward with reports.
And did the length of service or the complexity of service change in COVID?
I think something that I mentioned earlier, just a minute ago, we have noticed, because either survivors are reluctant to meet in person because they don't want to get COVID, or they're isolating at home. We've seen I would say, maybe the quality of services have gone down a little bit, in terms of like, we aren't having that face-to-face with them. There's less engagement from survivors. So we've seen the numbers increase, but we are not satisfied with the ways in which we've been able to interact with the survivors.
Thank you. Ashley, how did the program?
So we've been on a little bit of a roller coaster. At the beginning of the pandemic, particularly during the stay-at-home order, it was really like crickets here, and we were wondering, why is no one calling us? And it was very scary, actually, because we all know what's happening, and we're just kind of wondering, why is no one reaching out to us? So we really tried to do some extensive marketing and just, anything we possibly could to get our hotline number out there and information out there to survivors and individuals that might need our services. It's been a little bit different for our different programs. So our outreach program, where we assist with protection orders, that's actually increased a bit. From January through October, last year we served 233 individuals, and this year we have 240. So a slight increase there. So it seems that people are seeking protection orders over coming to shelter, because our shelter numbers are down actually slightly during that time, which I guess for me, it makes sense, because, you're told to stay home. So I guess people were staying home. They were just getting a protection order so they could stay home. And I think coming for shelter during this time had to be really scary for people. Not that it's not scary not in a pandemic, but, to leave your home and not know what to expect coming into a shelter. If you're going to be crowded with people, are there sick people there? What's going to happen to my family if I do bring them to shelter? We had a similar response with emergency room response. Those numbers have been down to, last year we were about 40 at this time, January through October, and we're about 20 right now. And I think that's understandable as well. Survivors are scared to go to the ER. That's where that's, if you're going to find a sick person, that's probably where they're going to be. So I think it's really important for survivors to know that, just because there is a pandemic going on and you're being told to stay home, it doesn't mean you shouldn't seek help, shouldn't seek treatment. That you might have to talk to an advocate over the phone, hopefully not anytime soon, but just to know that services are still very much available to you, no matter when and whatever is going on in the economy and in a pandemic.
Something that we did to kind of address exactly what Ashley is talking about, because we saw a huge decrease in numbers of survivors going to the hospital. We were not getting even referrals from partner agencies. We were getting less referrals from police. So we did a messaging campaign. It was both like a social media campaign, as well as we took flyers to our food pantries and grocery stores and gas stations and anywhere where we felt like survivors would still be going to get things that they needed during the pandemic, and just said, we're still here. We have a 24/7 crisis line if you want to call us. We did some messaging around how the hospitals were taking precautions to make sure that survivors were still safe when they would go to the hospital to get an exam done. And so we intentionally kind of did that because we were seeing such a decrease in numbers, and we didn't want survivors not to seek help during these times, especially because now our numbers are showing that with our cases increasing again, a lot of the cases are the perpetrator is a family member. And so we know that things were still happening within the house when they were isolating and staying at home.
And these are all really important pieces of information for lawmakers to know, especially when we think about the fact that this is not ending anytime particularly soon, and we need to keep planning around this. I think, for at least half of the next budget cycle, we will be working around these conditions. And so it's important for us to share that as we're talking about funding increases, and I do go back and forth from pre-COVID to now COVID to post-COVID, but COVID is going to be a condition for programs during at least the first year of the next budget cycle. So we do have to pay attention to the additional work, the additional layers, barriers, and costs as well. And so, doing these calls every Wednesday with different regions, and I am so used to it that I forget that some folks might be watching for the first time. So I do just kind of want to provide some introduction in that we are here today to talk about what victim services are available, but mostly to focus on what the Victims of Crime Act cut has presented in terms of capacity and services. So just a brief primer, the Victims of Crime Act grant is the main funding partner for rape crisis, domestic violence, all crime victim services across the country. It was developed during the Reagan administration, and it is not taxpayer funded. It is instead funded by deposits of fines from white collar convictions at the federal level. So for the past 36 years, this has been the main funding stream. So the purpose of nonprofits is to fill spaces that the government has chosen or knows it's more efficient to have a local content expert fill. So we're providing a service the government recognizes it needs for its constituents, but has chosen to contract out instead. So it does take the form of a grant, but it does operate very much like a standing partnership because many of our programs have been in operation for decades. So we have a benefit that we're providing, and what's been very helpful is that in the past few budget cycles, the state government has created and started funding rape crisis programs in the state budget. But for the decades prior to that, the state hugely benefited from this resource, but did not provide funding for it from our own operating budget. So we were very, very reliant on federal funding. And the federal government had consistently provided that. We were warned 2 budget cycles ago that we were given a smaller cut and told there would be another one and to plan accordingly. So we had gotten an increase in crisis centers line item and used that to really bolster services. And we wanted to expand to make sure we hit all 88 counties. We were at just under 80, and we were able to increase by 3 counties, not 11, but most programs were using that money to keep their doors open as we waited for that Voca cut. The Voca cut ended up being dramatically more intense than anyone could have predicted. And the reasons for that really are at the federal level, choices to not pursue prosecutions or to settle or defer or in some way approach cases in a manner that leads the money to end up being in the general federal budget instead of the Victims of Crime Act fund. So there's less prosecution, and when it is being prosecuted, it ends up going a different way and being put somewhere else. So we've had a range from 33% rape crisis specific, 33 to 57% cuts. Most programs utilize up to 90% of Voca, or 90% of their budget is Voca based. And so this is a massive, massive cut that's going to have a very large impact. So I'm wondering if both of you can share pre-COVID, not pre-COVID, pre-cut. Everything is pre-everything because our conditions have changed so much in the past few months. What has your program been using Voca funding for?
Sure, I can go first. So we use Voca funding for everything related to survivors of crime. That's what it's for. So for us, with our Day One program, we use it for to pay the advocates who work with survivors. We use it for survivors of sexual violence and human trafficking. We have an elder victim ministry program, and so we use that to work with elder victims in our community. We also have a special victims unit for underserved victims of crime, so survivors from immigrant communities, survivors of color, survivors from the LGBTQ population, any type of survivor that maybe is underserved in our community. We also use it for our CASA program, working with children who are abused or neglected. It's a guardianship program. We have domestic violence services in Putnam County, so we use it for that, for all survivors of domestic violence. And then our court program, which I spoke about earlier, within those two counties. We use it for professional development for our advocates to make sure that we're providing culturally responsive and trauma responsive services. We use it for mileage, for financial assistance for survivors of crime. So as you can imagine, there's a huge amount of cost associated with being a victim of crime. And so in the past, Voca has helped pay for those costs that survivors have to incur as a result of being a victim. So those are some of the ways that we've used it in our community. We also used it to pay for a therapist, a trauma therapist, who would be able to do counseling services for free for survivors of crime.
And can you share what you've tentatively discussed cutting back on with the cuts that have happened?
Sure. So last year we did get a cut. It wasn't as significant as this year. And so what we had to change last year was moving our therapist's position from an employee to a contract position. And this year, with an increased cut, we had to actually end that contract, unfortunately. So we are right now trying to find other ways to help pay for that so that we don't completely lose that service for survivors. We've seen that before 2015, we didn't have a therapist on staff. And so we saw the number of survivors who engaged in therapy services exponentially increased when we had it in-house. We were able to talk about, what that therapist could provide. And they could, we just had more control over that. And with that contract getting cut over this last year, the hours getting cut, we've seen a decrease in services again. Survivors aren't seeking those services elsewhere in the community, or they're not able to afford to pay for those services. There is funding available from the government for those services, but there's an application process, and that can be a barrier as well for survivors. The other thing that we've had to do is we had several open positions. So we have a hiring freeze in place right now. So we aren't able to fill those positions for elder victims in our community, which many of those we've known have experienced both sexual violence and domestic violence. And then we also have had some staff reduce hours. We completely had to take the emergency financial assistance out of Voca, and we're using donations from community members and things like that to help still provide that service. And then we also have a human resource director at our agency that helps provide services for our staff that then they can do those services, and we had to cut that position completely. And then the last thing that we've had to do is over the past several years, we've helped expand rape crisis services in our community. So we helped Van Wert start a rape crisis center. And then we were also doing work in Paulding County, and they actually took over Paulding County. And then we've also done some work in Shelby County and Auglaize County, Hardin County, and we have had to completely pull back on expansion of services in some of those communities that we previously were using Voca funds to help with.
Thank you for sharing that. It's so important to see the direct impact on survivor services, because as we talk about budget cuts and layoffs and all of that, it can sound like we're talking about the increased difficulty for us and our agencies and our management, but really what we're talking about is we're shrinking services for survivors. There is less available.
Absolutely. The other caveat with our specific cut of our therapist is she's bilingual in English and Spanish. And in our area of Ohio, there's very, very few therapists who speak Spanish. And so that is also a huge disadvantage to survivors whose primary language is Spanish, because they aren't able to find a therapist who speaks their language. And using an interpreter for therapy is just, it's not ideal at all. It's really not trauma informed, honestly.
Absolutely. Yeah, it's when you talk about that, there are so many barriers for so many survivors, and we can't, if we were having trouble meeting those needs before, in a situation that is going to be very, very a lot of people moving forward. Ashley, can you share kind of what your program uses Voca for and how this cut is impacting decisions you all have to make about what survivors will be able to access?
Sure. Similar to Crime Victim Services, Voca touched many areas of our programs here at Open Arms. Prior to the cuts, it funded 5 full-time positions here, 5 full-time advocates at our agency. So these advocates not only worked in our shelter, they provided court advocacy. They were working with children, not only in shelter, but also children that would come to support groups or need individual advocacy or support, as well as a supervisor for those programs, ensuring that our advocates are, obviously trained and, meeting all their necessary requirements to be an advocate within our agency. It also covered continuing education, professional development for our staff, which that's very important for staff, and it's not something that advocates can go do on their own. It's something that we as an agency want to be able to provide them, need to be able to provide them. So not having that funding source for continuing education is definitely, it hurts advocates, it hurts their ability to grow and develop within an agency. So that's definitely going to hurt us moving forward, because that has definitely been removed from our budget for sure. Pre-Voca cuts, they also provided us with just basic funding for supplies that we needed for our shelter. As you can imagine, when survivors come for shelter, they have very little with them besides the clothes on their backs. So even basic things that you have in your house, like laundry detergent or bedding, just little things like that. Like those are things that we rely on our community for. And with COVID, no one's making in-kind donations. So we're not getting that support from our community. And now we're not even able to get it from a funder either to meet those extra demands we have for shelter clients. So post Voca cuts, we have eliminated 2 full-time positions due to our cuts. We're not doing any trainings either, as I mentioned, and we are not able to purchase any additional supplies for our shelter. How this impacts survivors is pretty much, our advocates will be there no matter what, but there could be a delay in our response. We might not be able to assist immediately with a protection order application like we would have been able to. We have an hour response time to the hospital, which we still intend to be able to meet that, but we might be closer to the hour rather than 15 minutes, just because we're dealing with other situations. And, when you're cutting your staff, it just adds more work to them. The client numbers haven't went down, as we've discussed. They're growing or maintaining. So your staff is having to work with your other survivors while getting called on the same calls in addition to everything else that's going on. So I think that's the biggest thing that I would like to get across today is that, the needs are still there, the needs are growing. A pandemic has not stopped that whatsoever. And these cuts are detrimental to agencies just because we know we have to serve the survivors no matter what. And we just have to take that extra, maybe we might have to take that extra time, and just having them hopefully understand that, we'll be there for you no matter what. It just might take a little bit longer for us to get there to be able to provide you with those services.
Yeah, and I think that what I've seen with my staff is with COVID, there's been an increase in stress levels and just, the uncertainty of the situation. So they're already kind of at that higher operation level of being in stress all the time. And with the Voca cuts, caseloads are increasing. And so that adds stress to advocates. They're not able to spend as much time with survivors maybe as we were able to before. And they feel that pull from multiple directions of trying to do everything to make sure that the survivor is getting the services that they need, but being pulled in all of those directions. So I expect that we'll see an increase in burnout rates and people leaving the field because they aren't able to manage that many survivors at a time. And I think that we have to look at that because we already see a pretty big level of burnout in our field because of the trauma that we're interacting with every day, and the things that the survivors have went through also impacts the workers. And so when you put COVID on top of that, on top of the Voca cuts with an increased caseload, it's just it's a recipe for disaster. And so we're trying to do things that help provide that care to our workers so that they then can make sure that they're providing good services to survivors. But we know that it's a very stressful time for our advocates.
Thank you. And I'm wondering if you can speak in a little bit more detail about second, because I agree that is such a big piece of burnout and of work. And what will it potentially do to services and the loss of institutional knowledge? I think, as we all know, as you said, for me, I've been here for 5 years in Ohio working at OAESV. And in that time, I've met numerous advocates. Every training we give, we have a large number of brand new people. There are people who you meet at the beginning that come and go. They might work here for a while, have to leave for their own mental health and then come back, or permanently leave. And with that comes a huge loss of institutional knowledge. Each county, she has a lot to say. Each county in Ohio has its own court system and its own processes and local rules. And it's a very, we know, like for me, I know a lot of lawyers that we're trying to connect with survivors. Most lawyers won't even practice in a county that they don't have experience with because it's very intimidating. So all of the knowledge that's getting built up that could be refined and more robust and shared with new advocates is getting lost so frequently. Can you talk a little bit more about what secondary trauma might look like for an advocate and what the loss of that institutional knowledge does for survivor services?
Sure. So when we talk about compassion fatigue and secondary trauma, vicarious trauma, those are all ways in which, Laura Vandernoot-Lipsky describes it as exhausted hearts and minds. So when someone is every single day interacting with an individual who has been traumatized, they can sometimes take on that trauma themselves. So when we work with survivors who are sharing their truths, their stories with us, they're entrusting us with that trauma, and it can impact the way that we see the world, the way that we see ourselves or others. And that can mean that there's an increased level of sleeplessness at night. It can mean that people turn to alcohol or drugs to cope with what they're seeing. It can mean that people are on high alert or they're hypervigilant in situations surrounding them because they've seen what the world can do to others, and so then they kind of take that on themselves. But I really love Laura Vandernoot-Lipsky's definition of exhausted hearts and minds, and I think that's what we see with our survivors. So that's kind of what it means to have secondary trauma. It's literally kind of taking on some of that trauma that you're seeing every day and how it impacts you as a person. What was the second part of your question?
Sorry, what the loss of institutional knowledge means for survivor services.
Absolutely. And so we have some advocates who've been in our agency for many years. They know what they're supposed to do. They know how to work with survivors. And when we bring in new advocates, there's a lot of training that is involved. So in the state of Ohio, they have to go through 40 hours of training to even be able to do the job. But in addition to that, training is just hands-on experience is so valuable. So understanding our court systems, which again are different in every county, understanding who the prosecutor is and how, how to work with that individual prosecutor, or that individual detective, or that individual nurse at the hospital. And so the advocates are forming these relationships with our partners, and that's really valuable. And when you lose an advocate, you can sometimes lose that trust and that rapport that you've not lose it, but it just looks different with those partner agencies. And so they can trust us as an agency, which is really important. But you see that the advocates can build that one-on-one rapport with those individuals in our community, and when they leave, that can be lost, and it takes time to build back up again with the next advocate, because our partners have to get to know that person and know that they can trust our advocates as well in the systems. So.
Yeah, to piggyback on what Rin said, there are so many different teams and task force, whether it's a multidisciplinary team, a domestic violence task force, a sexual assault response team, different community groups that our agency is involved with. And the people in those groups, those teams, they really get used to the same staff, and knowing those staff, understanding how those staff are going to communicate with them, what their response is going to be. And so it's hard sometimes to break those barriers, to some walls that people put up, particularly law enforcement, I'll say. So they have, it's really hard to form that relationship. And so if an advocate leaves, one that has that trusted relationship within those different teams, I mean, that's a struggle for the agency and the team, because then the new advocate has to come in and not only learn about the agency, but learn about these different teams and groups that they're supposed to be working in, and how to get along with those groups, and how to break down those barriers of working in those different groups.
Mm-hmm.
So what are the main primary things that you will have to be cut, but will hinder direct services? And I think that you've spoken a bit to this already. So if there are not any additional items, but if there is one singular thing that you could identify that would be the most harmful but has to be cut, and you would like the community to know that might be lost if these Voca cuts are not restored and we don't get the state funding increase, what would that be?
I think for us, in addition to not having those therapy services in-house for survivors that are free, the other thing that I think will make a significant impact is we are going to have to cut down on the outreach that we do in our community. And I think that will directly impact our underserved victims, because in the past, what we've been able to do is partner with different agencies and go into some of the events and things that they already have going on, and partner with them and reach out to those underserved populations. And we just won't have the staff that can do that anymore with these cuts. And so I'm concerned about some of the communities in our area who already don't get the services that they need, that those are going to decrease even more.
Yeah, so for us, really, we're not cutting any services. It's really just going to be our response time, essentially, will probably be a little bit more prolonged than usual. If the survivor is used to us responding, within 15 minutes to the emergency room, or the emergency room is used to us responding within 15 minutes, we do have an hour response time. We're probably going to be closer to that hour. And same for protection orders. We probably won't have advocates immediately available to go assist with protection orders or to go on scene with law enforcement. And that's just something that we hope that our community partners will understand. And it's not that we won't be there. It's just that might take us a little bit longer because we're working with other survivors. So we have to obviously delegate our time equally as much as we can.
And I know that this is a difficult question because we are being hit by so many different issues right now: civil unrest, COVID-19, Voca cuts, a change in government. Everything is happening all at once. And this might be a big question, but what do you need among these? What do you need the community to know And this is a two-parter. So maybe we'll start with, we'll start with this instead. How do we collectively ensure survivors are not without access?
I mean, we have to advocate for support from our community, which I know that our community is already being stretched thin because of the pandemic, but we have to keep advocating. They have to understand how survivors are impacted by what they've been through and how important these services are for them. I think we have to find creative ways to seek other forms of funding that maybe we haven't thought of before. I think we have to share with each other ideas of how we're reaching survivors in meaningful ways, both with COVID cuts or COVID restrictions and Voca cuts. But those are some of the things that we just have to keep advocating within our communities to make sure that they understand how important these services are, and finding those creative solutions to funding.
Yeah, I think it's just really about being creative with how you're going to seek funding. I mean, there's a ton of grants out there. It's just really having the time to research them with, none of us have grant writers either. So that's just a whole nother task that's put on the director's shoulder to try to find that additional funding. And like Rin said, just letting your community know you're still here and you're still providing those services as very critical services to your community. So you need that community support. And we know that it might, the check written from a donor might not be as big as what it used to be, but any support, anything is crucial to helping us.
Thank you. I do need to apologize for smiling just now when you were saying that, because what you were saying was very important and not uplifting, but my child handed me her cute little boob. So we'll just brighten everyone's day with that for a split second. Strange times we're living in. So this is a big change for our communities. We've talked about potentially this resulting in 20 years of regression for rape crisis access. We've gone from less than half of counties having services in 2010 to having roughly 79, 80 counties with services. And I know it seems odd that I can't pinpoint that number, but it does change on a fairly frequent basis, especially because of the cuts. We are still monitoring data to figure out which counties will be removing services, because some rape crisis programs have an advocate for specific counties, and that might be what gets cut. But we're going backwards and we're losing an essential service for victims of crime that in and of itself is a problem, but we've done so much work, and the state government has done so much work to increase testing for backlog forensic medical exam results. They put a lot of attention and focus on increasing participation in the criminal system. Some survivors don't want to be in that system. Even if they do want to be in that system, it's confusing. It is full of Latin terms and procedures and appeals and motions and changes. And we're putting more people in that system and we're reducing advocates at the same time out of necessity because of budget cuts. So I think, it's so important that lawmakers remember that as we increase Marcy's Law, we are increasing victim rights. We're increasing guarantees on what a crime victim can have access to. We need the personnel there to do that, because none of this is intuitive, because the justice system is not intuitive. Do any of you, or do either of you, sorry. Oh, and I do just want to specify too, Rin, if you could share what you shared with me at the beginning of the call. So Rin is our regional leader for Northwest Ohio, and there were supposed to be a lot more people on this call. But COVID is affecting that. And I'm just hoping you can share briefly what folks are experiencing right now and how that impacts survivors and staffing structures.
Absolutely. So I got a text message and an email both this morning from different leaders of rape crisis centers And one of them said that she has 4 staff out right now because they have been exposed to COVID, so they had to quarantine. So she's down 4 staff at her shelter, which is a huge impact on the survivors that are staying in the shelter, but also the survivors in the community as well. So that means that the very few staff that are left are having to pick up the load and do everything to make sure that those services are still being provided. And then another one emailed me, and she had actually contracted COVID. So she had been out of the office for several weeks and had a ton of stuff to do to catch up on work now that she's back at the office. So it's impacting services most definitely. So we have to be able to have the staff so that we can stagger those schedules to make sure that if someone is out, we can still keep providing services. And we just can't do that right now.
We're going to be reeling from this for a long time, and I just think it's in a sense of what the budget cuts will do when we see what abrupt staffing changes look like because of COVID, and we see what reduced capacity looks like. There are all kinds of issues with confidentiality, with being able to provide services. You can see right now, I have a child in my house. A lot of people have children in their houses or family members they're caring for, or pets or roommates. And that impacts ability and capacity to engage on the phone with survivors while protecting confidentiality. So there are a lot of things we're juggling right now. And losing up to 0.5% of 90% of our main funding partner is a big deal. So I just want to thank you both. And if there is one last thing you'd like to say to the communities, to the lawmakers about what this cut is doing and what we need, the floor is yours.
I mean, I want to say that we're still here. We will be here regardless. So I want survivors to know that we have amazing advocates who provide that support and that care and that one-on-one attention that is so important when you've been a victim of trauma. And so if you're a survivor of crime, we want to help you. We are here. But we want lawmakers to know that this is impacting us, and it's making us stretch our already thin resources even more thinly. And so we need support, we need financial support, and we need to know that our lawmakers know how much work we do to make sure that our communities can thrive. And when we can provide these services, that's when we know that communities can start to thrive. And so we want to feel that support from them as well, with the policies that they enact and the funding that they provide to us.
Well said, Fran. To our community, I would say the same. You know, Open Arms is here for you, no matter what. We are here for you. Call our 24/7 hotline. Come to our office. We are going to be here to support you, no matter your situation. Our services will continue, no matter what budget cuts we take or whatever comes our way. No matter in a pandemic, our agency is here for you. To lawmakers, you know, we need you, we need your support. And I know a lot of nonprofits are probably knocking on your door right now saying, we're gonna need some additional money. But our services are really providing life-saving, you know, critical emergency response to survivors of domestic violence and rape. And, you know, survivors need us, and you need us as a lawmaker to provide these services in your community. Without community advocacy, you know, who knows what would happen. I mean, people are going to be left to their own devices to try to figure out things and be completely unsupported throughout a criminal justice system and not have emergency safety net services that they need. So I implore you to know your services in your community and to support them as much as you can.
Thank you so much for joining us today. I know it's early. I am personally not a morning person. I'm assuming a lot of people watching this know that about me. So anything that starts before 10 a.m., I'm so grateful that you all were willing to come, and especially probably pre-full cup of coffee. And if you or anyone has questions for us about how this is impacting the region or the state of Ohio, please feel free to reach out to. We will connect you with Rin and Ashley, and we are here to continue advocating for a reduction in cuts for future budgets and to continue advocating for the increase in state rate crisis center line item funds. So, thank you and happy Wednesday, everyone. Stay safe, wash your hands, wear a mask.